The cost of rehab can vary widely depending on several factors. In the United States, rehab can be expensive, but it's important to remember that the cost of not getting help for addiction can be even higher in the long run. There are generally two main types of rehab programs: inpatient and outpatient. Inpatient programs tend to be more expensive due to the cost of accommodation, meals, and round-the-clock care. Outpatient programs are usually more affordable. The cost of inpatient rehab can range from a few $1,000s to tens of thousands of dollars per month. Luxury rehab facilities can cost even more. Some people may be able to use health insurance to help cover the costs, but it's essential to check your policy's coverage and restrictions. Outpatient programs are generally less expensive, with costs varying based on the number of sessions and the types of services provided. They can range from a few $100s per month to several $1,000s. Many rehab facilities offer financial assistance or sliding scale fees based on your income and ability to pay. Some also accept Medicaid or other government assistance programs for those who qualify. It's crucial to research and compare different rehab facilities, consider your financial situation, and reach out to them to discuss payment options. Remember that investing in rehab is an investment in your health and future, and the cost can be a small price to pay for the chance at a healthier, addiction-free life. Don't let financial concerns deter you from seeking the help you need.
Does someone you love suffer from drug addiction? Don't wait until it's too late. Call our 24/7 helpline at 1-800-570-2259. A caring addiction specialist is awaiting your call.